For a long time, the European Society of Hypertension, ESH, excluded beta blockers from the first tier of antihypertensive drugs. Now, they have reinstated them. The explanation of Reinhold Kreutz, one of the co-chairs of the working group that created the document, is simplistic and unsurprising. Beta blockers were not previously considered first-line antihypertensive drugs, but in clinical practice many patients are actually treated with them because there are so many conditions for which they have convincing evidence or are considered favorable. In my opinion, the attack of various cardiology societies on beta blockers had only one reason: to push these drugs out of the pharmaceutical market in favor of other groups of antihypertensive drugs, given their very low price. However, the truth prevailed, and the 2023 recommendations of the ESH for the treatment of arterial hypertension brought beta blockers back into the first tier. I have always been on the side of beta blockers and have explained to my fellow doctors and, of course, to my hypertensive patients that catecholamine-dependent hypertension with increased heart rate cannot be cured without them. I welcome this decision by the ESH. At the same time, I also remind everyone that any recommendations, including these, are for educational purposes only, and that only a doctor can decide which drugs to use in the treatment of a given patient. So, please be careful with any treatment guidelines, and in a beta blockers mania, keep in mind that they are really often indispensable. Thanks for likes and sharing.